And we have got Dr. Adeel Khan.
Cutting something out like you do in surgery or giving you a pill to suppress the symptoms. We're trying to restore or fix the problem. People are frustrated with their traditional system. 60 million people see that. And then media outlets start talking about it. They're like, hey, what's this stuff? Why are these big celebrities talking about it? What's going on here? What's this new technology? It gets people talking and then it starts getting people interested.
Eventually be a potential cancer treatment also?
Yes, I know people are using it for that, and I think it'll be part of a program with immunotherapy and a few other interventions that are non-chemotherapy based.
That's interesting. I think it could be a major breakthrough. Hey, this is Sajeev Nair and yet another episode of Optimize Human podcast. Today I have got one phenomenally known medical doctor with me. He's actually creating some new ripples in the world of health and wellness. Many people are still not aware about regenerative medicine, but here is one man who has been actually doing it and practicing it and also helping a lot of people to regain your youth and also to come out of diseases and come out of pains. And we have got Dr. Adeel Khan out here for the podcast. Welcome to this podcast.
Yes, thank you for having me.
So Dr. Adeel Khan, I think regenerative medicine itself, in a way, many people still don't understand what exactly is it. So can you just in a brief, simple way, can you just narrate what exactly is regenerative medicine?
Yeah, I mean, I think the very basic definition is that instead of cutting something out like you do in surgery or giving you a pill to suppress the symptoms, we're trying to restore or fix the problem. We're trying to get your own body to heal. Our slogan for our company, for example, is empowering the body's natural healing abilities. Okay. So we're trying to get your body to heal using the right signals, the right scaffolds, for example, with tissue engineering, and the kind of the right growth factors and cells that you want to put around there. And so that's kind of the saying that we say. So basically, signals, cells, scaffolds. That's an easy way to remember it. And so those are the three kind of, let's say, pieces or ingredients you need for true regenerative medicine.
I always liked your statement, your cells can do much better than the pills.
Yes. Well, cells are the new living drugs, right? And the issue, though, with living drugs is they're a lot more complicated than drugs. It's not as simple as just manufacturing this one isolated chemical and putting that in your body. When you put cells in your body, there's so many different effects, and we still don't fully understand all those effects, but at a very high level, we do understand what's going on, and that we also see clinically the benefits that these interventions can have for a lot of people, especially for unmet medical needs.
This regenerative medicine or regenerative therapies, which has come, I think, to the world only in the last decade.
Yeah, I mean, regenerative medicine's been around for decades, but let's say the application of them has only been in the last maybe 10, 15 years. Yeah. But even in those 10, 15 years, there's been so much acceleration. Like there's so much more research published, there's so much more understanding. So things are changing very rapidly. And unless you're in this world, it's very hard to know what's going on.
Yeah, I understand what you're saying. Yeah. But why in this last 10 years, this kind of a growth has happening for this?
I think it's mainly because more than anything is just people are frustrated with their traditional system. They're realizing that, hey, if I have a bad knee and I go to my doctor, he's going to give me a pain medication and then he's going to give me a cortisone injection. And if that doesn't work, then it's off to surgery. And it's like, well, isn't there other options? And then, if you do your research and you realize there's so many other options. Why not try these other things? And especially because number one is always about safety. We have over 20 or 30 years of data on these type of stem cells, mesenchymal stem cells as they're called, on the safety of them, which is number one, always of utmost important. So at least if you know you're not doing harm and you can help a lot of these patients, why not try that first? And that's always been my logic with these interventions is why not try something that's going to be least harmful and can potentially have the same benefit as drugs or surgery.
But the awareness among the people is very less. Like I know that you are taking a lot of effort, going and speaking in various events. You were there in the World Biohack Summit. So, but otherwise, I don't think that level of awareness is there. So, is that a challenge which is there?
Yeah, well, that's why I took the approach I did, which is I didn't go down the academic scientific route, which is what most regenerative scientists do, right? Yeah. They work at universities or institutions, and there's so many brilliant researchers out there. But I chose to go down this route working with
straight to
big
the people.
celebrities,
Yeah.
with big, go on big podcasts and all this other stuff, because I was, in my mind, if I go down the academic route, there's no way I'm ever going to reach the mainstream public
That's
or
right.
reach the masses. And this is just never going to happen in my lifetime. It's going to take decades and decades. But if I go straight to, I go to Chris Hemsworth or Zac Efron, like some of the people I've treated that's publicly out there, there's 60 million people see that. And then media outlets start talking about it. They're like, hey, what's this stuff? Why are these big celebrities talking about it? What's going on here? What's this new technology? It gets people talking, and then it starts getting people interested. And then you start getting other people, and then you get investors, and you get all this other stuff. And then that just creates momentum and creates awareness about it. And I think now, even if you ask the average person, they would be like, oh yeah, I've heard of stem cells. Like they may not know what they are exactly, but they've heard about them, which is a lot better than where we were 10 years ago.
Yeah, stem cells, stem banks, and all those kinds of things. People are just aware. That's all. But the way a stem cells can be used or can be applied is something which is not known to people. Even I'm not sure whether the medical professionals know it in the right way.
No, and that's the problem. There's no set guidelines. And there's no standardization. And that's always been the issue with stem cells in general. And those are the problems we've solved for now, and which is why we're in this new era of, let's call it standardized cell therapy, where we have a standardized cell population. So we're using what's called a homogeneous population, meaning it's the same, versus heterogeneous. So the biggest issue with stem cells is, let's say I take a stem cell out of your body, or you take it out of my body from your fat, because that's like one source you can get it from, right? And the problem is your stem cell quality is going to be very different from my quality.
Right.
So there's no quality control. So there's variability, right? It's different. Yours is different than mine. How do you control? Then you might get a good result. I might get a bad result. And then it's like there's no consistency. And that's always been the problem with this whole field. There's all this variability. You get different donors and you have different quality stem cells. But now we can isolate a very specific cell population, which is called the mu stem cells, which we can talk more about. But that was discovered in Japan in 2008. And those stem cells can be isolated so you have the same population, and that's all you're using when you treat patients. So it's more like a drug. It's a standardized off-the-shelf product that gives you reproducible and consistent results.
So where do you extract the mu stem cells from?
So you can isolate them from any source that's mesenchymal. So mesenchymal is just an embryological term, which means like the middle layer when the embryo is developing. And so there's different sources. There's fat, there's bone marrow, even dental pulp. And then there's, of course, placental and umbilical cord. So the reason we use umbilical cord tissue is because if you think about it logically, your stem cells, my stem cells, unfortunately, are aged, right? We've gone through 30, 40 years of replication cycles, and they get old. So do you really want to use your own stem cells? Not really. And that's just logically, but then there's science to back this up too, is that when your stem cells, as they get older, they don't work as well. It's called stem cell exhaustion. That's one of the hallmarks of aging. So they're not able to repair. Why do we age in the first place, right? It's this accumulation of damage. It's our inability for our body to repair itself. There's all these different hallmarks of aging. But basically, in theory, if your stem cells could work indefinitely and your body could keep repairing itself, you could certainly slow down aging, if you think about it. And then, so basically what we can do is we can now isolate these mu stem cells, and then from umbilical cord tissue, because they've gone through 0 replication cycles, right? They're fresh. They're straight from the baby after C-section birth. They haven't had any replication cycles, so they have no damage on them, right? Your stem cells and my stem cells have damage because they've been through years and years of replication and cell division. So if you think about it that way, it makes the most sense to use donor stem cells. Now, the concern with donor stem cells was always that, hey, you're putting foreign DNA in my body. Isn't that going to cause some sort of reaction? And that's true. That was true with some type of cell, but with the mu stem cells, this is published in Japan and now in other countries as well, that mu stem cells are immunoprivileged, which means your immune system does not reject them. They can integrate safely into your body. They kind of go with what's called the logic of the tissue, which means they know how to integrate safely into your body and express the right genes. So they basically, it's really cool actually. What they do is when the mu cells go into your body, and let's say you inject them in your face, for example, and you have some damaged old keratinocytes, which are the cells that make up skin cells. Okay. And some of them are old and damaged. So they'll go in there and they'll eat them. And then they engulf them, and then they'll turn into new keratinocytes. So they'll turn into new skin cells. Wow. So you're actually, not only are you actually reversing some wrinkles in your face, for example, you're actually slowing down the skin aging process. So that's why it's so much more better than just like Botox, which is just like temporary thing, right? And even we were talking about exosomes before we started. Exosomes are signals. Exosomes are the soup that the stem cells grow in. So they have the anti-inflammatory signals and the growth factors, but they only stay there for hours, maybe to a few days at most, and then they're gone. right? And they alter gene expression. They have microRNAs. They reduce inflammation, and they're still great, but they're very temporary. Versus the cells, they're actually integrating. So that's why it's very different, and it's much more potent. And that's why it's exciting, because mu cells are pluripotent, which means they can actually turn into all 200,
Anything.
over 200 cell types in your body, except cancer. And that's the exciting part about mu cells
Now,
too.
how do you make sure that it won't turn into a cancer?
By definition, it's non-tumorigenic, because there's something called pluripotent genes.
Yeah.
So these are genes that have been studied using single-cell RNA sequencing, which is basically you're basically studying the genetic profile or cellular signatures of these cells, and so you figure out exactly what's in them. And so for these mu cells don't have that, it's called c-Myc. It's a specific pluripotent gene that's linked to cancer that the iPSCs, the Yamanaka stem cells have, and that they don't have that. So they have so they're by definition they're non-tumorigenic, and then also obviously clinically we haven't seen that in any of the research, we haven't seen that in any of the application, and then also Professor Dezawa, I know she's in the process of publishing some research on how these mu cells actually suppress cancer growth. So this is what we mean by they're smart drugs. So for example, if the mu cells go into your body and they see a cancer cell, they're not going to tell it to grow. They're actually going to tell it, hey, you're a bad guy, stop growing. And they're going to help it to suppress growth. Yes, and that's what makes it really interesting and exciting.
Do you think that this can eventually be a potential cancer treatment also?
Yes, I know people are using it for that, and I think it'll be part of a program with immunotherapy and a few other interventions that are non-chemotherapy based.
That's interesting. I think it could be a major breakthrough.
It will be. I mean, I know for a fact, because I know scientists working on that. So it's very exciting. Yeah.
Why this is not that much known to the world?
Well, that's a long question. Long story short, Professor Yamanaka, so he's the one in Japan who got the Nobel Prize. He discovered these iPSCs, induced pluripotent stem cells, right? Those are the cellular reprogrammed ones. They're the ones basically you express these transcription factors which can make an old cell young again. So obviously everyone was like, hey, we're going to cure everything. We can reprogram cells. Yeah. Everyone thought that this is the beginning of the end of like disease. But it turns out when you use these Yamanaka factors, it actually makes those cells cancerous. So they're embryonic in nature, which means they can cause tumors or uncontrolled proliferation.
In all cases?
In all cases. And that's why they're called iPSCs. iPSCs are still not safe for human use. There's research starting to happen in humans, but the reality is when you put iPSCs in your body, there's always a risk that they can turn to cancer, and we don't really know exactly how high or what the magnitude of that risk is, but it's there. And so we don't want to do something that's unsafe. So I'm not comfortable using iPSCs, and most doctors aren't either. And of course, it's still very early stages in the research for clinical application of those cells. But because Yamanaka won the Nobel Prize, and rightfully so, it was an amazing discovery. He got a lot of attention, obviously, and of course, and then Professor Mari Dezawa, who's also in Japan at the same time, she discovered the mu cells in 2008 and then published about them in 2010. She unfortunately did not get as much attention, and then for a lot of political reasons and being a patriarchal society and whatnot, they just never gave her the attention that she deserved, even though her discovery was equally as breakthrough in my opinion. But now obviously I feel like I discovered her, I guess, almost in a way, because obviously I went straight to the source. I went to Japan, I worked there this summer, and I hung out with her, and I learned all about them, and now I'm telling the world about them. And obviously I think there's a lot more people interested in them, and I know for a fact she's been approached by a lot of people in the last few months, just because there's a lot more excitement and about scaling this technology and bringing it to the world.
That's exciting. So how long have you been working on this mu cells?
I've only been with her for the last year, really. But again, I'm more the, let's say, the clinician that when doing the application but the scientists are the scientists, and I have.
But on the application side, what kind of results you have seen till now?
It's been amazing, honestly. I wouldn't. Because obviously I've gone through the progression, right? I've used PRP, the platelet-rich plasma. I've used exosomes. I've used stem cells from your own body. Then I've used umbilical cord stem cells, like regular MSCs, mesenchymal stem cells, and now I'm using mu cells. So I've gone through the whole ladder, and now I feel like I have something that's consistent. It works. And I've had many patients, the old stuff didn't work, like for example, the regular stem cells, and then this worked. So I have many patients like that. And then I also have just very challenging cases like long COVID, fibromyalgia, cases that are very complex, and people who have no hope, people who are even multiple sclerosis, like all these different conditions that are deemed, untreatable essentially. We're able to help them, and we're able to sometimes get them into remission. And it's just a matter of dosing. And that's the beautiful part about this. And then obviously there's the longevity applications too, which we don't even fully understand how amazing it is for longevity yet, because we haven't done a controlled study yet. But that's going to happen, in the next year or two, where we measure aging and we really see how much of an impact it's having. But anecdotally, I can tell you, people say I look younger, and people say, I see it with patients all the time. They look younger, they feel younger, they have more energy. I've had patients who are in their 60s or 70s, after they do the stem cells, they literally say they feel 10, 15 years younger. So we see those subjective reports all the time.
I know that you actually treat many celebrities. So I'm very curious to know that, most of the things what you do are innovative. And maybe even if you talk about the Muse cells, it's about a year you have been doing it. So how come the celebrities agree to do this kind of things on their body?
Yeah, it's a good question, because I guess it is relatively new, and it's like, hey, but I think it's because a lot of people, once they understand that, hey, because Muse cells are a type of mesenchymal stem cell, right? They're just a subpopulation.
Yeah.
And mesenchymal stem cells have been studied for over 30 years. And there's over 1,500 or maybe even 2,000 PubMed studies on them now, right? There's thousands of studies on them. Like it's not a new thing. So we have a very good understanding of how mesenchymal stem cells are safe in the body. And just because Muse cells are a subpopulation of them, we know based off that data that they're going to be safe. And then, of course, the additional data that Professor Dezawa has produced, we have all this safety data and clinical trials as well. People feel pretty comfortable saying, hey, there's a lot of safety data out there. I'm willing to try this, even though, yes, maybe it's new to the Western world or new to this part of the world. It's not really new if you think about it, right? It's been studied, and in Japan, it's been done in phase 2 clinical trials in stroke and heart attack and like difficult to treat conditions. So it's not really new per se. It's more just taking something that's been used in other parts of the world and being able to bring it to a wider audience.
So I think, Doctor, it's quite amazing to see these the way the Muse cells is going to really take the entire, I believe, the healthcare system by storm. Can there be any negative consequences of this kind of treatment?
So with stem cells, the concern we talked about was one about cancer, and we talked about how Muse cells don't have that risk. The other concern was about rejection, which Muse cells don't have. And then the other concern was, will these cells survive in the body? Will they go in there and will they just die? And then will they become what are called senescent cells? Like zombie cells, and just cause more inflammation. Yeah. And that's what happens with traditional stem cells. Traditional stem cells, 95% of them die in the body. But Muse cells stand for multi-lineage differentiating stress-enduring cells. So it's a mouthful, but we can break that down. So stress-enduring, SE, just means it survives in harsh environments. So that's the big difference. So it's not going to die in your body. So you're not going to get all these senescent cells that are forming as you do with the regular MSCs, the regular mesenchymal stem cells. And then multi-lineage differentiating, MU, that part means they're pluripotent. They can differentiate into all three lineages. Yeah. And so that's all that word means, it's a great name. So I commend Professor Dezawa for that as well. But basically, because these cells are able to survive in the body, you're not going to get those kind of side effects of having more inflammation or more problems down the road. So the level of safety we've seen so far in the clinical trials and also clinically, just applying it in the real world, we haven't seen any major side effects with it, which has been fantastic. Obviously, anytime you do a procedure, it doesn't matter what type of injection you're doing. There's always risk of infection or bleeding, but that's very rare.
That's always there.
But that's with anything, right? Yeah. And so, other than that, there isn't really any risk that we've really come across.
That's interesting, and I think the whole process takes about 2 to 3 hours.
Yeah, for an infusion. I mean, that's the convenient part. As someone who has limited time and very busy and running companies and doing all this other stuff, as a lot of people who are listening, I'm sure are, then I'm always trying to find the most time-effective thing. For example, let's say hyperbaric oxygen. That's something that can be helpful too, right? It has very similar effects as stem cells in terms of mitochondria, in terms of, telomeres and blah, blah, blah. And so, but you have to do it every day for an hour or 2 hours. And it's like, I don't have time for that personally. So I'm not going to do that for longevity because I just don't have that type of time. But the stem cells for me, I can do it. I can go once every 6 months. I just do my infusion and it's done. And so it's so quick and easy.
No, and on the other side, now gene therapy also is becoming very prevalent, and a lot of discussions are going on the way genes can get edited and how this can be a solution to some of the major diseases. Even to the extent that geneticists started talking about death is going to be optional by 2045, 2050.
Well, I think that's a whole other. If you want to talk about that, I think quantum biology and cellular reprogramming is really what's going to lead to biological immortality. But on the note of gene therapy, we have follistatin gene therapy, which is our it's the world's first reversible plasmid gene therapy. But basically, it's an injection. It's a peptide, but it's on what's called a plasmid vector, which is derived from E. coli. So it's derived from bacteria. Plasmids are like,
is that a gene therapy?
Yes.
Oh, okay.
Yeah, that's the technology.
Using the same CRISPR.
Not CRISPR. It's a different CRISPR because CRISPR is great, obviously, but the problem with CRISPR is that it can have off-site targets. So it's like, imagine you're cutting scissors and you're trying and you accidentally cut something that you don't want to and you put it, and then you can have off-site. So CRISPR has way more potential than, this is called MiniCircle, the company I work with, MiniCircle's plasmid technology, but MiniCircle has a lot more ease of use and again, history of safety, because plasmids have been around for a long time and they've been used in the clinical setting, or at least in research setting, for decades. But this is the first company to use it in a clinical setting in humans. But plasmids are very inert, which means that they're basically a way to carry a gene or insert a gene into your body. But the plasmid itself is non-immunogenic, so it doesn't stimulate your immune system. It doesn't migrate. It just sits there and tells your own cell to produce more follistatin. And then that morphollistatin is a peptide. It's a bioidentical peptide hormone. It inhibits myostatin, which is an enzyme that sets a limit on how much muscle you can grow. So essentially, morphollistatin means you can put on muscle easier, you have more strength, you have more energy, and it slows down aging. There's only been one clinical trial done with this so far, and it showed pretty significant. Like people over age 60 had average. This is using True Age Diagnostic, had an average of 11 years biological intrinsic age reduction, which is pretty significant. And Brian Johnson did the injection with us with MiniCircle, and he talks a lot about it because he went to Honduras, which is where the company started. But we offer that injection in Mexico and in Lithuania, and we're in the process of getting approval to do it here in Dubai as well.
Oh, this is interesting. So it builds a muscle. That's what you're saying. So as such, I think as you age, you are losing muscles like almost like 1% every year or something.
After age 30, it's 0.5% a year, and then that accelerates after age.
So this is rebuilding the muscle just through this.
It's the only potential treatment. I wouldn't say it's fully proven yet because there needs to be more research done. But it's the only potential treatment that can.
But you have seen results.
Oh yeah, for sarcopenia, which is age-related muscle wasting, and such a big problem. It's an epidemic actually, and so I've seen patients. And this is almost hard to believe, but I've seen it, and we have DEXA scans to confirm it. DEXA scan is muscle fat that put on 10 pounds of muscle, which is unbelievable, right? With one injection after 6 months, that's like hard
just one injection.
But I wouldn't say that's the norm. Most people only put on maybe a few pounds of muscle, but still, if you're in your 60s. And you do this injection and you put on even 1 or 2 pounds of muscle, that's a big deal because you're not losing muscle. Or even if you slow down muscle wasting, right? Like I think this has a lot of potential, and it's one of those things that should be more accessible. Right now it is expensive, and I think that's the biggest issue. But as time, again, with these technologies, as time goes on, it'll become more affordable.
I think one of the things what happens with anything which comes in the space of science and technology, in the beginning it'll be expensive. As more users come in, it becomes more affordable.
That's the way exactly. There's no economies of scale yet. There's no, assembly line manufacturing. There's all this stuff there's going to be improvements in all the kind of.
So, Doctor, now many celebrities, people who are actually in the influential circles started talking about living more than 100 years, living for 180 years, 150 years, different kinds of targets, and it's creating different opinions also in the market. So what do you think with this kind of science and technology developments? These are kind of things which are going to be normal?
Well, first, I think people need to understand, why does our body age in the first place? And right now, it seems like the front runner has to do with our mitochondria, which there's some super interesting little creatures in our body. And the reason I call them creatures is because how did mitochondria start? You know, it's
an organelle coming in from outside.
Yes, and then and that was several billion years ago. But basically, these mitochondria, which we have trillions of them. We have something like 35 trillion cells, and then we have. Every cell has 1,000 mitochondria. So imagine you just have so many mitochondria in your body, and what's their job is not just to produce energy. They're like little sensors. They sense when the body starts going array, which means when there's too much inflammation or there's too much what's called oxidative stress, too many free radicals, then the mitochondria they don't work as well, and then they get damaged. So mitochondria have their own DNA. It's called mitochondrial DNA. And then there's nuclear DNA, which is in the cell. And as both of those accumulate damage, then they can't do their job, right? Because what is DNA? Think of it like as a library. It's instructions for how to carry out what needs to be done. But when those instructions get damaged and the workers who read it, they can't read it, and they're like, what do I do? And then they make the wrong things. They make the wrong proteins. And then this is what starts happening. And so your body starts to break down as you age because there's more damage and your body can't repair itself. So there's a very interesting field right now called quantum biology, because what's really happening, if you look at the mitochondria, it's electron transport chain. So these are electrons that are being transported from complex 1 to complex 4, and then eventually ATP is being made, which is energy. But as that electron transport chain happens, it's actually a quantum phenomenon, because quantum is just, people always get like, oh, what's quantum? Quantum is just a fancy, it's not even a fancy word. It's just, all it means is just how tiny particles behave, right? And because the classical world is very different from the quantum world. The quantum world, it doesn't behave like we do in classical world. Like, meaning in the quantum world, there's all these phenomena that happen that would not be possible in like the physical world as we see it. For example, there's something called quantum tunneling, which is very relevant to electron transport, which is that it can basically transport, like, let's say there's an electron that's trying to get through that wall and then it gets stuck. In the classical world, it wouldn't be, obviously a particle can't go through the wall, but in the quantum world, it can appear on the other side of the wall. And that's called quantum tunneling. And so there's all these interesting things that happen in the quantum world that don't happen in the physical big let's call it the big world. And so that's where a lot of scientists are starting to figure out, hey, we can exploit these quantum phenomena to do what we want. And that's obviously what quantum mechanics has been used for so many breakthroughs in, like, MRIs and in medicine already, and obviously a lot of GPS and a lot of the real world applications. And then obviously now just Google has a quantum chip. So there's all these things that are happening in our world. So I think the word quantum has to be understood by everyone to really understand. Now it's like you have no choice but to understand it, because the world we live in, because quantum is going to be everywhere. And in biology as well, I think eventually there'll be applications where it's like, hey, how do we keep this quantum phenomena in the mitochondria efficient as possible for as long as possible, so that we can slow down and fight aging? And so to that end, to answer your question, so basically, if you can keep that mitochondria healthy indefinitely and keep that energy production healthy for as long as possible, then in theory, maybe you could solve aging, right? Then maybe you wouldn't age at all, or you would significantly slow it down. With what we have right now, the mu cells, to come back to them, because obviously you can tell how much I love them, is that they transfer mitochondrial DNA. So they're actually giving you new DNA that's young, that doesn't have damage.
Okay.
And then they're also doing what's called mitophagy. They help to repair damaged mitochondria. And then they also help, they help with AMK, they help to regulate mTOR, they help with sirtuins, they help with all these pathways that we know are related to longevity. And so they're really going to be impactful for longevity. And in my opinion, right now, there isn't a better intervention out there for your mitochondria and therefore for aging than there is the mu cells. So just, that's just where the science is right now. That's not to say that will change. That will obviously change, because there's going to be more significant things happening. But I think one of the biggest ways that we're going to slow down aging is to keep that mitochondria healthy as long as possible. And for now, the mu cells, and obviously, people talk about NMN and NAD, and
these are all pathway activators.
These are all for mitochondria, right? But this is just a much more potent version of that, the mu cells. And then I think eventually we'll have the other thing that's very promising is cellular reprogramming, which we talked about, the Yamanaka transcription factors. Imagine if you could use those without causing cancer. So you could use, because this is what's being worked on, basically using 3 of the 4 transcription factors to make old cells young again. So cellular reprogramming. So imagine you could just make your old cell, you could say, hey, skin cell, I want you to be young again. So you just put these transcription factors in there and they could make it young. So that's something there's a few companies working on that, and there's big names behind that type of stuff. Jeff Bezos has a company called Altos Lab, and Sam Altman, the OpenAI guy, he has a company called Retro Sciences. They're both working on cellular reprogramming. So there's billions of dollars being poured into that. So I think eventually there's going to be some breakthroughs in cellular reprogramming as well.
But that effect can be brought in by immune cells also, right?
Yes, because immune cells are going to help with mitochondrial DNA damage and with nuclear DNA damage. So they are making your cells younger. And they are also eating, like we said, you're going to get new cells that are younger by definition, because they're going to eat some of the damaged cells and they're going to integrate.
So effectively, what we talk about normally as a biological age can be brought down drastically.
Exactly. But I mean, that's another topic. How accurate are those tests? They're not super accurate.
I know
Methylation is not the most accurate thing, but there's a company we're working with right now they're from Harvard, called Generation Lab. They measure biological noise, which is basically the amount of, let's say, your mistakes your genes make over time, and that one is more accurate than just the typical methylation test, because it uses a nonlinear algorithm and all this mathematical stuff that I don't fully understand. But the point is it's more accurate. But then there's also another technology that, again, and this is how fast the field is moving. It's called proteomics, which is the proteomics is the most accurate because proteins are the end product, as we were talking about, of the gene expression, and that is the best way to measure aging. So there's companies out there now doing that.
Okay, this is from the blood test.
Yeah.
Okay.
And they take your blood and then they centrifuge it. They take the plasma and then they can measure the proteins in there.
So we can actually expect that people are going to live longer, healthier.
I think that goes without saying. We already have stuff that's doing that, and we're seeing that in the real world.
No, I think that's a great news, mainly because I think, like what we were talking about, the pain, having pain is almost like normal for most of the people, like, having a shoulder pain and going on.
Yeah, and treating pain is more than just treating pain, because it becomes it's longevity. Because when you have, let's say, a chronic knee pain, you stop being as active. You can't do what you like.
You can't perform.
It affects your mood, and it affects your overall mental health, but then it also affects your activity level.
Yeah.
And then you stop, and then you gain weight, and then your metabolic health becomes worse. You get insulin resistance,
Yeah,
you have obesity, you have inflammation, and then your longevity and your health starts going down. So it becomes it's more than just treating a knee. And I've seen that all the time, right? It's restoring people's health and life back to normal.
So, when we are seeing that even nowadays, the lifestyle diseases like diabetes or blood pressure, or whatever it is, a lot of people consider it as normal, like in the sense that it's okay, like, I'm having blood pressure, that's okay. I think people also have to start becoming aware that there are ways by which you can reverse it, and these are not normal. You don't require to have this all the time. Even I know some people who are having one or other form of pain, back pain or shoulder pain, and they're living with this, with popping some painkillers and all those stuff, and they think that's normal. Like, once you age, you get all these kinds of things. So you are trying to disprove that, right?
Yeah, I mean, I think age-related diseases, to me, are very interesting to solve, because we know that there is a correlation between, obviously, age and obesity and cancer and autoimmune conditions and high blood pressure and all these things, right? As you get older, there's a bigger risk of having these. So obviously there is something to aging, but aging isn't the only risk factor, right? Lifestyle is a massive risk factor, and obviously genetics play a role in that too, but it's more about epigenetics, and it's about the expression of those genes and what the environment that they're put in. So we know that modifiable risk factors are going to be the most impactful thing. And if you have muscle, if you exercise, you sleep, you stress management, all the stuff that you talk about all the time, if you're going to do that stuff, that's going to significantly reduce your risk. But let's say you've done that stuff, or you can't because you're in too much pain, you're too tired, or whatever, then that's where these things can be very helpful, because yes, they can actually improve your metabolic health. We can use peptides all the time. Peptides are a great thing, adjunct that we use with stem cells all the time. And combining those, we can do what's called metabolic reprogramming. We can change the cellular signatures of your fat cells, of your muscle cells, of actually your body, so that you're kind of going from this pro-inflammatory state to an anti-inflammatory state, and then your metabolic health, your cells are more insulin sensitive. All this stuff happens. Your white fat cells go to beige fat, right? And there's all these interesting things, and so there's all these interesting things that these technologies can do.
Metabolic reprogramming, I think Dr. Adeel Khan, I think that is something which people have to take it from this discussion, because I think people have to start realizing that there is a way by which you can live longer, healthier, being productive and contributing to the society. You don't need to get aged. Definitely you will be, but the way people think about aging is completely different. So I think it was a great conversation, Dr. Adeel Khan. I believe the most of the things were new to most of the people. I'm sure that people will do their own search and they will find out more about it. But I'm really amazed about this kind of concepts because I've been going through and testing many things on my body. So I've been experiencing this, whether it's exosomes and now it's the muse cells, So I believe it has been a very, very good conversation. Thank you, Dr. Adeel, for this wonderful exploration into the future of health.
Yeah, thank you for having me. It was fun, and we'll talk again soon.
That was Dr. Adeel Khan for you.